Good morning, distinguished ladies on the high table. Good morning. Good morning to the new global president as well. And good morning to the St. Maria Goretti Old Girls Association. Thank you so much for having me. I'm so honored. And a special thank you to my sister, my friend and colleague, Dr. Tina Anetor, for inviting me to this. When I walked in here, I was like, oh my God, my school, we need to do better. We need to do more. I immediately sent a video to my president and said, just look at this. What do we need to do now? So I'm very pleased to be here, and we're going to copy you guys, hopefully. But we were only founded in 1984, so that's our excuse. My school is called Federal Government Girls College, Buari in Abuja. So thank you. So when I was thinking about today, I mean, Dr. Aneto told me about this a few weeks ago, and I've been thinking, what do I do? What do I do with 15 minutes or 20 minutes? How can we make it? And one phrase kept on coming to my mind all the time, and I don't know why. And it was advocate for yourself. Advocate for yourself, which means be your own lawyer, be your own defender, be your own carer. And maybe there's a reason for that. So rather than have anything academic or formal this morning, I'm going to share a little story with you. As you all know, I practiced in the United Kingdom for 22 years, and I decided to come back last year, October, finally. Thank you. So the shocking lack of knowledge about midlife, about perimenopause, about hormonal changes, and it's just not out there. So when I set up a clinic, well, the clinic is me, so I consult out of 2 hospitals, Evercare and Marcel Ruth, and I do that, and I try and see just women, and mainly women in midlife. I can see anybody, but I think women in midlife were important to me. And when they would come and say, well, my head hurts and my body hurts, and I'm feeling low, I'm feeling depressed, and my sex life is 0, I'm not even interested, it's not even crossing my mind, all of those things. They didn't put it together and realize that actually it's because I don't have any estrogen, I don't have any progesterone, and in some cases I don't have testosterone. There was just no connection. And when they would say to me, I'm like, okay, so what have you been doing all this time? Oh, I went to see another person, and they said, don't worry, you've had your kids, you're okay, what is it? They've been fobbed off, as we say in the UK. They've been kind of just ignored and told to just suck it up, deal with it, and continue caring for your family without complaining. No. Advocate for yourself. You are very important. Your health should be first, and how you feel should be first. So that was the first thing I noticed. I noticed this resignation to like, oh well, it is what it is. The women just accept it. Well, I'm not feeling well, but a lady came and her blood pressure was so high, and I'm like, well, if you leave, you might actually not make it home because it's so high. So that, well, it's my son that is causing. Well, it's there was this. And is it a depression? Is it what is it that makes women just not be that bothered? Or maybe it's a resignation. I can't do anything about it. So, well, whatever happens, happens. But they don't feel that way about their husbands, and they don't feel that way about their children. So why do you feel that way about yourself? And then I noticed also this low access to interventions about the perimenopause and the menopause. Obviously, there's so many things you can do. You don't have to suffer. All the hot flushes, they don't have to happen to you. There are things that can be done. And obviously, at the last resort is what we say hormone replacement therapy. That's like a dirty word in Nigeria. I don't understand why. Whenever I said, they're like, no, not for me. And I'm like, why? Well, because it causes cancer. I'm like, okay, well, that was the Women's Health Institute study in the 1970s, and that has been debunked. But there's no connection with that. So today, actually, if anybody wants to see, I brought some HRT, so you see what it looks like. If you're interested, you can have a look at the latest ones we do, which is topical, mainly spray on your skin if you're ever in, but at least you know it's there. But there's also no access to it in the pharmacies. Of all the women I prescribed it to, only one could get it in this country, and the lady got it from her workplace. So her workplace actually provided her with the latest HRT possible, and I mean that workplace should be celebrated, I think. So I'm going to wrap it up there, and I take questions. Obviously, for me, their lifestyle changes are number one. You want to make sure that you are praying, you are resting, you're walking, you're exercising, you're taking your vitamin D, you're taking your vitamin B. Those are really important things. Drinking water, making sure that your diet is clean, and we're very lucky in Nigeria. We have clean food. Dirty food in the UK. You have really clean food here. No GM modification. It's fresh, and so you can actually just have. We have too much of it. I think that's what the issue is. Like, we have good food.
Seated. Good morning, everyone. Okay, my name is Obe Hinaudi. When I saw you initially, I said, I know this face. I'm registered with Evercare as well. So, in April, I'll be 51. I still see my menstrual period. I just saw it like a few days ago. Very heavy. And I want to prepare myself for that menopause stage. I would like to know, because I hear people saying, hot flushes, my body is hot, I can't sleep in the night, memory loss, blah, blah, blah. And there are some things you can take if you are not in that stage yet to help you curb it when you get to that stage. So I would like to know what can help when one gets to that, or before one gets to that stage.
I mean, that's a fantastic question. You should be preparing for the menopause from when you are 30, from your whole life, really. So yes, you should be. So I think the first thing, because one of the biggest things we worry about is a loss of bone density. So the first thing really is exercise. So particularly weight-bearing exercise. So not just any kind of exercise, but dancing, walking, things that will strengthen your bones are number one. And then your vitamins are really important, and just being aware. Your sleep is important, really being careful and protecting your space, making sure that you're sleeping well. Exercise, honestly, is number one. So, and I always say exercise really should be about 5 times a week. We really need to go for it the older we get. And 30 minutes each time is so important. So as far as you're doing those things, your exercise is there, you're drinking lots of water, you're having a positive mindset, you're sleeping well, then, you're really well on your way. If your periods are really heavy, it's perimenopause. Makes the period really, really, really heavy before it then starts to taper out. But I have patients who are almost 60 and still have regular periods. Doesn't matter. It's okay. As far as it's regular, then it's okay. It's only if there are issues that we think it could be cancer. But that would be spotting and irregular, so I wouldn't worry. There's another question here. I hope that helps. Yeah, vitamin D, very important, because vitamin D helps you to absorb calcium, which helps your bones, right? And the vitamin B is great for your memory. So those two are important. People talk about all sorts of B and D, yes. So D, I put them in the order of importance. So D first, and then B. People talk about all sorts of vitamins. Please don't fall for those things. Because what I find is that I have patients who have like 7, 8, 9, 10 vitamins in their cupboard, and they can't really keep up with any of them. So there's no point. Take vitamins specifically for a particular thing, not just because someone said it's good. Okay, is there a question here?
That'll be our last question.
Okay, last question. Sorry. Yes,
Doctor.
You take that lady. The lady. Yes, thank you, ma.
Yes. May I know your name, please?
My name is Dr. Simi Alabi.
Okay.
Yes.
You just mentioned vaguely about the HRT.
Yes.
I'd like you to give us more information about how good it is for women over 60, 70. Is it okay?
Yes.
I'd like you to.
Okay. I definitely can. If we had enough, run to my bag and bring it and show you, but I don't think we have enough time, so I won't do that.
Yes.
Sorry?
Yes. We like
I have to take permission from the... Should I go and get it from my bag?
we have time.
Can I go get it? Okay, I've been given permission. Oh yes, thank you. I mean, I have patients who are on it forever. You don't have to stop it at all. So I'll show you. I think that's everything. Okay. I have no shares in these companies. I have no vested interest, no conflict of interest. I just brought it as a visual aid. So before, we used to say be on it for 5 years and stop. The guidance has changed. You can be on HRT forever. So the one that I've been advocating a bit more is the spray, topical spray. So we went from tablets, and then we still have tablets, but I think that the risk is a bit higher with tablets. We went to the pump, which we still have the gel as well, but yes, transdermal. So this one is so easy to use. So it's just a spray, like that, on the skin. On your skin, yeah. So you just spray it like that, and then make sure it's rubbed in. And then that's the estrogen spray. And then, but because you cannot take estrogen on its own, if you still have your womb in, because if you take estrogen on its own with your womb in, what will happen is the lining will get thicker and thicker, and that can cause cancer. So because of that, we have to take micronized progesterone. It just means that it's very biosimilar. So it's similar to the one your body produces. And we give usually one every night of the micronized progesterone. That keeps the lining of the womb thin so that there's no chance of cancer. And then lastly, this is not for everyone, testosterone, only if your testosterone is very low. Because sometimes the woman, what she's experiencing is low testosterone symptoms. And the estrogen does not help. So we measure if it's below 1, then we say, well, we have testosterone gel. But we don't have any made specifically for women. So we still use the one made for men, but lightly, but that can be, yes. So, yeah, low dose, just rub it on the skin as well, transdermal as well. Does that help? I can use it forever. I mean, women are on it forever. I have patients who will say, don't even dare tell me to come off it. Don't even dare to even think about it, because I'm happy, my skin is good, my sex life is amazing, I'm sleeping well, progesterone helps you sleep well. Why would I stop it? There's no reason for it. As far as you're getting checked, your breasts are being checked, you're having all your regular health checks, you're fine. Okay.
Thank
Yes.
you. Thank you very much. Excellent.
You're welcome.
Short, precise. If you haven't started at all,
Yes.
in your 40s, your 50s, your 60s, can you start after the age of 70?
Well,
So because that gap,
yes, that's a more technical question, which I think maybe should be a one-on-one question. We always like you starting it earlier the better, before 50, but it doesn't mean that you can't start it after 60. Because the more of the benefits around cardiovascular benefits, bone health, all of that are better a bit earlier. But the hope is not lost. If you're older than that, then you have to speak to a doctor that has a special interest in women's health, not necessarily a gynecologist. I refer to a gynecologist if I can't manage that woman. But you can, but it's better, you're absolutely right, to start earlier rather than before 50. I want to take her question and find out, please, because she's been had a hand up the whole time. The lady in the red, please. Thank you so much. Final question.
Thank you very much. I want to ask about the safe period. When menopause, when you stop menstruating, it will come after 3 months.
Yes.
Come again, maybe after 1 month, 3 months again. So how do I ascertain my safe period?
That's an amazing
scared,
question.
yeah.
That's a really, really important question, actually. So we should give her a round of applause, please. It's the reason why that question is very important is we have seen women who are late 40s getting pregnant. It can happen. 50s getting pregnant. It can happen because they assume that they're no longer fertile. So we always say that HRT is not contraception. Number one, assume that you are fertile if you are still having your perimenopause. So you should have contraception. If you're not having, and it could be condoms, it could be the pill, but we always say that put a coil in, a copper coil, it has no hormones in it. Put it in, remove it after 55, because after 55, the chances are almost zero, right? So the copper coil, for those women who don't want to have hormones, I put copper coils in all the time, because women just come and it's safe, it's easy, there's no hormones. The ones that don't want hormones can have the copper coil. But you cannot ascertain when you're going to release an egg and ovulate in the perimenopause. You can't tell. So it's better that you actually have your contraception till the age of 55 at least. Does that make sense? Yes. Yeah, okay. Thank you so much, everybody, for listening and making me feel welcome. Thank you.